Hi, my name is Teirra Delgado. I am a nursing student at HGC. I'm in my 3rd semester. I'm going to be doing a skills checkoff for nasogastric insertion today. Prior to going into the room, I have checked the orders and the allergies, and I've also gathered my supplies. And now we're going to be going into the room to insert the nasogastric tube. So now that we're in the room, we're going to ask the patient's name and date of birth. What's your name and date of birth?
My name is Aaron, and my date of birth is December 28th.
Okay, perfect. So now I've put Aaron into a high valvular position and make sure that he is in a comfortable spot for him. I've also explained the procedure to Aaron and how this is going to work. I've handed him the ice chips in his cup, and I've also given him an emesis basin in case he gets sick or feels like he needs to throw up. Next, I'm going to put on my gloves. I don't have any, so I'm going to pretend I've already done hand hygiene and I have provided privacy for the patient. Now that the patient is in a high valvular position, I'm going to take my pen light and I'm going to check the patient's nose. Tip your head back as far as you can, and I'm going to make sure that there's an opening inside of both nares. I'm going to see if there's any irritants or any abrasions, and then I'm also going to see which nostril has the best airflow for the tube. So now that I've done that, I'm going to go ahead and take my tube that has markings on it so that I can see where I need to stop. I'm going to measure from the nose to the ear and then down to the xiphoid process. So that's where we have marked our tubing at. I'm going to place the tubing into the lubricant so that the tubing for the nasogastric has lubricant at the end to provide comfort for the patient. So now that I've done that, I'm going to place the towel across my patient's chest, and then I'm going to ask them to hyperextend their neck back, so lean your neck back as far as you can, and I'm going to go ahead and start inserting. So I'm going to insert this tube, and once I tell you, you're going to start swallowing. You're going to take bits of ice, okay? So I'm going to flex it in, and I'm going to get in there. So then go ahead and take a bite of your ice chips.
Okay.
And as they swallow, I'm going to insert 2 to 4 inches until I get to my indicator. Once I get to my indicator, I'm going to go ahead and secure it so that I can listen. I'm going to insert 5 to 20 mLs of air. Listen for it. And once I have listened for the 5 to 20 mLs of air, I'm going to aspirate back with my syringe, and I'm going to take my pH paper and test it on my pH paper. We are going to also, of course, get it confirmed with an x-ray to make sure that the NG tube is in the right spot. I've educated the patient that it might be uncomfortable, but you can go ahead and swallow. If they have any other complaints, they can keep using the ice chips to get it down a little bit. And then I'm going to remove my supplies and throw away my stuff into the trash, and I'm going to document how the patient has handled it and the rest of the procedure.